Hi, everybody. I'm Dr. Marc Riedl from the University of California at San Diego. Thanks for joining me today for this session, which is about chronic sinusitis. And so I'm going to talk a little bit about the condition and also the causes or factors that lead to chronic sinusitis. And then we'll talk about management, of course. And we know that this is a very common problem in primary immunodeficiency conditions. So I hope that this will address some of your questions and be of interest to you. So here's what I'll cover in the next few minutes. We'll talk first a little bit about the anatomy of the sinuses, because I think it's important to understand what are these things and why do they cause problems for us, particularly in immunodeficiency. We'll talk about the factors that may lead to chronic sinusitis and some of those contributing issues that we should be aware of when talking with your physicians and specialists. And then we'll finish with some of the management strategies. And I think you'll see it's a bit complicated. So there's a number of things we have to think about when we're managing chronic sinusitis. So let's start first with the anatomy. What are these things, the sinuses? And so there's a couple of diagrams here. As you probably know, these are sort of hollow spaces in our skull that sit mostly in the facial area. And it's interesting to think about why do we have sinuses to begin with. One is to make our skull lighter. If our skulls were solid bone, including the face, our head would be heavier and we'd have more trouble keeping ourselves upright. So it helps to balance the weight of our bony skull. The second is that it does play an important role in humidifying, warming, and filtering the air that we breathe. So when you breathe through your nose, it comes through the sinuses. The sinuses do a job to make sure that as that air goes into the lungs, that it's both clean and warm and humid, which is good for our lung function and less irritating to the lungs. And lastly, the sinuses probably play a role in our ability to speak well, to sort of phonate and project our voice. So those are the best thoughts as to why we even have sinuses. The sinuses have different names. You see them here, and they're based on the location of where they are in the face or the skull. So you can see the maxillary sinuses here sit kind of behind the cheekbones. Those are probably the ones we talk about the most because they are susceptible to infection, and we'll talk about that in a second. The ethmoid sinuses are sort of these small collection of cells kind of behind the nose and between the eyes. Those are smaller than the rest, and those often are also affected by inflammation. The frontal sinuses, you can see, sit above the eyes, kind of in the forehead region. And then the sphenoid sinuses, we probably talk about these the least because they sit way back in the skull, kind of in front of the ear. These are probably the least likely to be affected by inflammation, but when they are, they can be very difficult to treat because you can imagine it's hard to get medicines back into this area that sits back sort of laterally in the skull. And then on the right, this is a CT scan image, as you probably know, and I'll just point out, you have the sinuses, but you also have these tissues. So the septum is, of course, this cartilage and tissue down the middle of the nose, and these outpouchings are called turbinates. These are soft tissues in the nose that can expand and contract depending on temperature and exposure to irritants and other things. So there are tissues, there are bones, there's cartilage in these areas that we call the sinuses. All right. Beyond the anatomy, though, these are not just stagnant bones and tissues. There's actual activity that happens in the sinuses. And this diagram on the left sort of shows you some of that activity that's constantly happening. Our tissues in the sinuses and in the rest of our airway have these specialized cells that you see on the bottom. These are ciliated cells, and their job is to sort of move things along in the sinuses and in those cavities. So you can see there's cilia, these little hair-like structures that actually have a coordinated movement. And then there's the mucus that our cells produce to sort of capture particles and allergens and bacteria and viruses and move those things along so they don't stagnate and set up shop in our sinuses. Now, the interesting thing, you see these arrows in the diagram, this is actually the direction that these cilia move things out of the sinuses. And what you'll notice immediately is that they have to work against gravity. In the maxillary sinuses in particular, those ciliated cells have to move the mucus, the bacteria, the allergens, the particles up against gravity if we're standing up, and out through this complex, so either to the nose, so that's when stuff comes out of our nose, or down the back of the throat, which we swallow or sometimes end up coughing out. So one of those two places, your cilia are moving materials out of the sinuses on a constant basis. It also works up here in the frontal sinuses. You can see there's a little bit of activity against gravity, and then it can drain using gravity. So this is how the sinuses function in a normal, healthy state. Now, on the right of this diagram, you can see what happens when things are not going right. You can see there's some fluid that's collected here, which again makes it very difficult for these cells to move the material out of the sinuses. You can see there's some swelling of the tissues here. The turbinates are all swollen up, and that causes a problem in this area. We call this the osteomeatal complex. That's this area kind of between the eyes where you can see there's not a lot of room because of how close the tissues are together. So if there's swelling, if there's infection, if there's allergy, if there's inflammation, these areas get clogged up or obstructed. And now, again, you can't move things out like would happen if everything's normal and healthy. Things get stuck, they get blocked, and that's where we start to run into problems with either sinus infections or inflammation that causes chronic sinusitis. And on the right here, I just show you again a CT scan that shows, again, when things go wrong. You can see both the arrows and the stars are things that are abnormal here. The arrows show the blockages in this osteomeatal complex because of tissue that's swollen. The stars show fluid or tissues that are swollen in the sinuses, indicating either inflammation, or if there's fluid, sometimes that indicates an infection. So normal function and abnormal function, and that's going to be important for us to think about as we talk through chronic sinusitis. All right, well, that is background. Then let's dive into this problem, chronic sinusitis. First of all, what is it? Well, we often call it chronic rhinosinusitis, or CRS for short, because in most people it involves not just the sinuses, but also the nose. There's inflammation in the front part of the nose often as well. This is a very common problem. We know it's a big problem in immunodeficiency, but if you look even at people who have normal immune systems in the general population, it affects more than 10% of the general population at any given time. So we see certainly a lot of this in the allergy immunology setting, but family physicians, internists, pediatricians, they see a lot of chronic rhinosinusitis, even in people without immunodeficiency. And this does have a specific definition. It's really chronic inflammation of the nose and the sinus tissues for more than 12 weeks. So we know that sometimes acute sinus infections due to viruses or bacteria can last for a couple of weeks, a few weeks sometimes even. But if you get out that you're having chronic symptoms for more than 12 weeks, that becomes chronic sinusitis. And we'll talk about in a moment how usually that's not just infection. There are other issues that we have to think about. There's three subcategories or types of chronic rhinosinusitis. The most common is this first one, CRS without nasal polyps. That's what most people have. But these other two types are important to think about, especially when we're evaluating people with chronic sinus problems. CRS with nasal polyps. And nasal polyps are not terribly common, but they are an inflammatory polyp or tissue that can be found in the nose and indicates sometimes a specific underlying issue, a type of inflammation that sometimes requires a little bit of a different treatment approach. And then allergic fungal rhinosinusitis. This is not very common, but it is important to think about if there are particularly severe symptoms that are not responding to usual treatments. And if people are producing lots of very thick mucus, sometimes that's a fungal exposure. It's not necessarily a fungal infection that causes invasion, but a robust allergic response to a fungus in the nose. And anyway, that also requires sometimes very specific treatment, but it's pretty clear on imaging. It has a very distinct appearance. So if we talk about the symptoms of chronic sinusitis, and most people are very familiar with these, but the most common ones are nasal obstruction, so difficulty breathing through the nose, A lot of mucus production. Now that could have some color to it. It might be clear, but usually people either have lots of runny nose or a lot of postnasal drip that's pretty constant down the back of the throat. Facial pain or pressure is another common symptom. You see the little individual cartoon here with the headache, or it could be dental pain. Sometimes people feel it kind of behind their front teeth that it's constantly sore or painful. I would say about headache, a lot of headaches are blamed on sinus problems, and it's true that chronic sinusitis can cause headache issues. However, there's lots of other reasons to have chronic headaches or recurrent headaches, and it's always important not to only zoom in on just that chronic sinus problem. Migraines, it turns out, are much more common than people think, and so sometimes if you're treating sinus problems and headaches aren't getting better, we have to sort of think more broadly. Could it be a migraine? Could it be a tension headache? Other types of headaches are also very common. A loss of sense of smell, and certainly people have talked about that a lot in the last year because it's one of the potential signs of COVID infection. But this is, of course, loss of reduction in sense of smell, usually gradual over time as the sinus issues get worse. And that's sometimes a hallmark of polyps, the nasal polyp type of chronic sinusitis that I mentioned. Chronic cough is very common. There's many reasons people can cough, and we worry, of course, about the lungs causing cough, particularly in immunodeficiency. But in fact, upper airway inflammation like chronic sinusitis is often more commonly the reason people are coughing, because that dripping from the sinuses is very irritating, and your reflex of your throat and your lungs is to cough to protect any of that dripping from getting down into the airway. So that's very common. And then you see a variety of other things. Ear pain or pressure, halitosis or bad breath can sometimes be a sign of sinus problems, irritation of the throat. And then fatigue. You see the little cartoon that's very tired up there. Many studies now showing that people with chronic sinus problems actually do experience fatigue from that. So it's not just a local issue. It can sometimes cause other systemic problems, including feeling tired because you just don't feel well from those chronic symptoms. All right, what are the causes of chronic sinusitis? And this is actually a fairly extensive list. I've sort of abbreviated it here, but we often think of infection, I guess, number one, because people think of sinusitis must be an infection that's causing it. And certainly that's important to think about. There is, at least in theory, the idea that you can get an infection and that may start problems with chronic sinusitis, but it may not be that the infection is persistent, rather that it triggers inflammation that then lasts for a very long time. Whenever we talk about immunodeficiency, of course, we have to consider the problems with infection. And so that's always at the top of the list, particularly with PID, that could there be an infection causing sinus problems. However, it's not that simple in most cases, and we have to look at other possible factors. Allergy is probably across the population the most common contributing risk factor, because many more people are allergic than have immunodeficiency, of course. In some forms of immunodeficiency, allergic conditions are actually a lower issue, less common, but certainly we have to think about allergy really anytime, and sometimes it's worth investigating that to see, is there some chronic exposure that's causing inflammation? We talked about the anatomy. I call these structural issues, and that's the fact that if there's chronic sinus problems, perhaps there's something blocking the usual drainage. Could be a polyp, could be a cyst from old infections, could be scarring from a previous surgery. Sometimes surgery helps initially, but it leaves some scarring and abnormal tissue, and therefore that can cause down the road more chronic sinus problems. Or maybe it's something people are born with, a deviated septum, or they had a traumatic injury. So there are structural things that we need to consider if there's chronic sinus issues. I'll mention smoking. I hope you know that smoking is very bad for many respiratory problems, and that includes the sinuses. So exposure to that smoke, whether it's smoking by the individual or even lots of secondhand smoke exposure, that it's very harmful and irritating to the sinuses. And then airborne irritants or pollutants. These are things like chemical exposures or carbon monoxide or diesel particles. Most of the studies in chronic sinusitis indicate you have to sort of work in a profession or have a chronic, sort of everyday exposure for that to really be a strong consideration. But some people in their work or in their hobbies or leisure activities, they're around pollution or irritants very commonly. So that can play a role in some of the sinus issues. All right, in the last few minutes, let's talk about management. So for people who are dealing with chronic sinusitis or have been diagnosed with this condition, what are the treatment strategies that have been shown to be helpful? And the theme here is that it's complicated. It's often has to be sort of a multifaceted approach to really help with these persistent symptoms. So infection, we talked about it already. It's sort of the thing that people jump to first, particularly with immunodeficiency, because it's always a concern. And there's no question that if you have an immunodeficiency, that should be strongly considered. For the antibody deficiencies, which are the most common types of immunodeficiency, there are certainly a number of conditions where immunoglobulin replacement therapy is indicated as standard treatment for those conditions. And there are studies showing that if one has antibody deficiency, that immunoglobulin replacement is very important in reducing the frequency and the severity of sinus problems. And that includes, at some level, factors that are important for chronic sinusitis. So I don't want to, that's not trivial. I don't want to belittle that. It's very important as a sort of a mainstay of treatment for the antibody deficiency. However, immunoglobulin itself is often not going to be sufficient to relieve all the symptoms of chronic rhinosinusitis. It'll help with the infectious issues, of course, reduce the frequency and severity of those, but it may not address a number of other factors that we're going to cover in a moment. So we can't stop there is the point. We've got to look beyond just the infection issue and the immunoglobulin replacement therapy. Antibiotics. So again, this is very commonly people are treated. If you have sinus problems, you may talk about or get antibiotic treatment because of this concern about infection. And the distinction here is between acute sinusitis. So you get a fever, you get facial pain, you get lots of stuff coming out of the sinuses, you have signs of a cold or a respiratory infection. Certainly, there may be a role for antibiotics there. That's an acute infection that is going to last for a couple of weeks, and the antibiotics may help get rid of that quicker. However, what we're talking about is chronic sinusitis. Remember, usually 12 weeks or more of symptoms, and the role of antibiotics in that setting are not very clear, meaning that we don't know if that actually helps a lot of the time. We know in immunodeficiency that sometimes it takes a little bit longer of antibiotic course to get rid of an acute infection. So if things aren't getting better and you clearly had an acute infection, it's not unreasonable to consider a few weeks of antibiotics. Some experts say up to 6 weeks of antibiotics. But beyond that, prolonged or chronic antibiotic treatment is really not recommended for chronic sinusitis because it doesn't appear to be that helpful in many studies. And if additional courses of antibiotics or antibiotics are going to be used for an extended period, it's really worthwhile to look and see what bacteria are we aiming for here. The ENT specialists are best at the culturing. They can use their instruments to get back into the sinuses because taking samples from the front of the nose is not very accurate in terms of the cause of acute sinus problems. So it's the message is antibiotics are usually not the answer for prolonged, protracted chronic symptoms. And if one's going to use those for any extended time, you really need to know what bug are we treating so that the antibiotics are targeted appropriately. Some other important considerations for treatment: nasal irrigation. So this is using a saline solution to rinse out the sinuses. And this actually has been shown in some small studies to be helpful for chronic sinusitis symptoms. It, as you can imagine, helps those ciliated cells sweep out the mucus, the particles, the infectious organisms. It helps your natural defenses function better and get some of the gunk out of there, so to speak. So doing this on a daily basis can be very helpful. It's recommended that one use either distilled or sterilized water to reduce any risk of very rare infections that could come from tap water. And there are over-the-counter saline packets that one can use to add to that water to make it comfortable and less irritating to rinse the sinuses. Or there are recipes to make your own by adding some salt and baking powder or baking soda to the water. So, but at any rate, there's different techniques. You can use a neti pot, as you see in the one diagram here. You can use squeeze bottles to get that water up into the sinuses, and then it drains out the nose. And this is worth thinking about and talking with your doctor about if you have chronic sinus problems, because while it's not the easiest thing to get used to doing, it can be very helpful and is generally quite safe to do this with the recommended procedures. The other treatments include anti-inflammatory medicines. So intranasal steroids, these are often delivered by sprays, but can also be used sometimes with rinses under the guidance of an ENT or an allergy immunology specialist. These work slowly, but those steroids are very good at reducing inflammation and reducing the swelling that sometimes causes a lot of chronic sinus problems. These work slowly, so you have to do this on a daily basis, usually for several weeks to get the full benefit. And one of the mistakes we see sometimes is people use it for a few days and they don't see a difference, and so they stop. It doesn't work that quickly, so we have to give the anti-inflammatory effects a chance to really help the inflammation and therefore the symptoms. And then there's other anti-inflammatory medicines, anti-leukotriene drugs you see listed here, or other allergy medications. These are going to be most useful in people who have evidence of environmental allergies, but it's again, because those are so common, it's worth looking into that and considering these other anti-inflammatory medications. And then I put systemic steroids, steroid pills on the bottom here. We use these very infrequently for chronic sinus problems because of all the side effects of taking steroids. Even for a week or two, there can be significant side effects. And of course, in immunodeficiency, we worry quite a bit about suppressing the immune system any more than it already is due to the immunodeficiency condition. So this is generally not an approach that we take, but sometimes when things are very bad in the sinuses, very chronic, we will try a short course of these sorts of medicines to try to bring down that inflammation and kind of start over, wipe the slate clean, and then use some of these other approaches to maintain that improvement over time. I'll say just a word about sinus surgery. There is a place for sinus surgery, of course. It's typically if there's structural abnormalities. So if you need to move some obstruction out of the way or repair a deviated septum, the surgery can be very helpful to correct some of those structural problems. But generally, we try to avoid this and use the medical therapy. If that really is failing over time, then sometimes surgery is something that, again, we try to use to start over, so to speak, to kind of make a lot of progress quickly. But then you have to go back to the medications, the medical therapy, to maintain that improvement over time. And I'll finish just with the fact that there's a lot of work going on in chronic sinusitis because, again, it can be such a struggle. Despite all these things that I've shown you, many people still have considerable problems and ongoing symptoms with sinus issues, and especially that's true in immunodeficiency. So some of the ongoing research is looking at devices, so putting a small device in the sinuses that will deliver a medication slowly over time, and gradually improve and maintain that anti-inflammatory effect. There are some targeted antibody treatments now. These are the so-called biologics that we use that really block a very specific part of the immune system. Those have mostly been shown useful in the nasal polyp type of chronic sinusitis, but there's interest in potentially using those in other forms of sinusitis, and we'll have to see if that ends up being safe and effective through the studies that are done. And then some specialists have occasionally recommended nebulized or topical antibiotics or other medications. We don't have a lot of data to know how helpful that is. It's usually not particularly harmful, but we also don't know how effective it is. So some of you may have have heard of this or even tried it, and we just don't know a lot about how well that works. So we need more data on sort of nebulized and topical medicines beyond the steroid medicines that I previously mentioned. And of course, when you use antibiotics, we worry a little bit about resistance developing over time. So I think we'll need more data in that area, but there's a number of approaches here that show some promise for improving the treatment of chronic sinusitis. So with that, I hope you've enjoyed the presentation and found it informative. Hopefully it'll be helpful to you in your lives and with your ongoing medical care. And we can move now to the question and answer period of the live session. Thanks for your attention.
Okay. Hello, everybody. This is Christopher Scalchunes. I'm Vice President of Research at IDF. That was an excellent presentation. You know, we do a lot of surveys at IDF, and thank you for those of you who fill those out. And when we ask about other kind of current conditions along with PI, chronic sinusitis is always literally the very top answer. So I hope you enjoyed the presentation as much as I did. Before we get along to the Q&A, please remember that each individual's treatment and condition is unique. The information presented during the session is not medical advice, nor is it intended to be a substitute for medical advice, diagnosis, or treatment. Always seek the advice of a physician or other qualified health provider with questions concerning a medical condition. At this time, please join me in thanking Dr. Marc Riedl from the University of California, San Diego for that wonderful presentation and saying welcome to the Q&A portion of this session. So the questions are starting to pile up here, Dr. Riedl. And just a note to everyone out there, we'll keep going as long as the questions keep coming in, at least until our stop time at 4:30. So keep them coming. Okay, so let's get started. First question for us is, can chronic sinusitis affect your ears? I often have the feeling of water in my ears, but my nose is fine.
Well, thanks, Chris, and hi to everybody out there. Thanks for attending today. The answer to this question is yes, absolutely. Chronic sinusitis can affect the ears, and that's related to the fact that the pressure is equalized from your ears into the sinus cavity. So something called the eustachian tubes run from your ear into the sinuses, and so if you have chronic sinus problems or inflammation or swelling in the sinuses, that can often block up or obstruct those eustachian tubes that are meant to sort of have an opening to equalize the pressure in your ears. So this is not uncommon that people with chronic sinus problems will have ear pain or pressure or feel like there's fullness in their ears, and is often a sign that there could be some swelling around the opening of the eustachian tube. It's also part of the reason people with sinus problems sometimes have trouble flying, because the cabin pressure changes as you're on the plane, and that can sometimes cause a lot of ear pain and difficulty equalizing the ear as that pressure changes. So certainly these sorts of symptoms in the ear are seen with chronic sinusitis.
Great, thank you. How long should a typical course of treatment for acute sinusitis last? I know you touched on this a little bit during your presentation, and they also asked, are there preferred antibiotics for acute sinusitis?
Sure. So this is a little bit of a complicated answer. Generally speaking, for run-of-the-mill acute sinusitis, we think that a week, give or take, of antibiotics is usually a sufficient course. But it's one of those things that has to be really individualized at some level. And of course, here with the IDF meeting, immunodeficiency is an issue, and our general experience, or my general experience, is that people with immune deficiency sometimes need a longer course of antibiotics to have the same effect. So it depends on the person, it depends on the underlying condition, but generally I would say we start with 7 to 10 days in that ballpark, and we sort of see how it goes. Certainly I have patients that require longer than that require a couple of weeks for an acute sinus infection. And we have to track it, right? We have to see. We would expect people to be getting better in that first week, 5 to 7 days, if we're on the right track. And that sort of moves into the second part of the question, is preferred antibiotics. Again, it depends on where you are, what the bacterial resistance rates are in your given part of the country. Most of the time, we still try to start with penicillin type of medicines when we can. Those can still be quite effective in some areas. But some people are allergic to penicillin. Sometimes there's resistance to penicillins. And so other antibiotics that we use often include doxycycline. There's some oral cephalosporins like Ceftin or Omnicef that can be very useful. And then as we go down to stronger and stronger antibiotics, there are times when we still have to reach for antibiotics called the quinolones. This is something like levofloxacin, which has a very broad coverage for lots of types of bacteria. And we try to reserve that for people that have, been resistant to other treatments, because there are, of course, side effects with any of these drugs, and the quinolones have been associated with potentially more side effects. So that's kind of a short list of antibiotics that we consider. But again, it sort of has to be tailored to you, what your doctor thinks will work best. And as I think I mentioned in the talk, when we start to have trouble treating with antibiotics, getting a culture can be really useful, so we know that we're using the right antibiotic for the right type of infection. Those cultures are usually done by the ENT docs to take a sample.
Great, thank you. Here's an interesting one. You did touch on the topic of biologics, and the question is there a suggested order in which to try them?
Right, so the biologics, there's increasing interest in using these newer types of medicines, sort of targeted medicines at the immune system to try to treat certain forms of chronic sinusitis. Most of the work so far has been done in people that have chronic sinus issues along with nasal polyps. And there's 2 biologics right now approved for treatment of sinusitis associated with polyps. One is called dupilumab, and there's probably the most experience with that. It's been sort of approved for the longest time for sinusitis with nasal polyps. And the other one is called omalizumab, and that's also an allergy type drug that now has been shown to help with sinus issues related to polyps. So I'm not sure there's a correct order. Again, that kind of depends on what you and your doctor think is best in your situation, because there are some slightly different side effect profiles. But we sort of have the most experience with dupilumab and then also the FDA approval of omalizumab. And I think for people who have had nasal polyps, those can be really, really helpful to try to prevent those polyps and the associated sinus disease from recurring and better controlling it.
Interesting, thank you. So we have a question about the saline rinses, and someone states here that they've heard that adding a small amount of baby shampoo to the lavage or the rinse helps with chronic sinusitis. Is that a valid question, or have you heard that yourself?
I have. It is a valid question. It's a question I don't think we know the answer to yet from a clinical standpoint, meaning does that work, reliably for people who have sinus problems? What I can tell you is that the interest in that has come from something called biofilms, and this is sort of research in sinus disease. Biofilms are sort of a thick mucus covering with mucus and other sugars that sort of coat the sinuses. And there's been this concept over the years that chronic sinus disease may be very difficult to treat in some people because there are these biofilms. It's sort of this thick layer that the bacteria burrow into. And this biofilm protects the bacteria from antibiotics and other things that might get rid of them and sort of get rid of that infection and or inflammation. And so this idea about baby shampoo, along with other types of substances, is that baby shampoo is what we call a surfactant. It sort of breaks down these thick biofilms that otherwise might be protecting bacteria and inflammation. And so the thought is if you add a little baby shampoo as a surfactant to break down those biofilms, you might be able to more effectively clean out the things that are causing blockages and inflammation of the sinuses. So this is something people have suggested. There's a little bit of research showing that, yes, it may be helpful in certain instances, but we haven't had sort of a major big study to know that yes, this is something we should recommend to everyone. So I would still call it a little bit exploratory, but it does seem to be safe. And so I suppose it's sort of on the list of things that could help, probably won't hurt, but we don't know the true answer as to how helpful it is yet.
Great, thank you. This is a question here that I'm sure a lot of people have. So the question is, I have CVID, including low IgA. Is this a factor in chronic sinusitis?
It probably is. So as people may know, IgA is its sort of specialty as an antibody is patrolling the mucosal surfaces. So that includes your airway from your nose all the way down into your lungs, and also your GI tract, the mucous membranes there. And so it's thought that if you're missing IgA, you probably have some increased risk of having more issues with sinopulmonary infections, including sinus problems. It's probably not that straightforward because there are people that are missing IgA that are totally healthy, and so their immune system is able to cover for that without problems. But if you have CVID, you have low IgG levels and low IgA levels, then you're probably not able to compensate for that missing IgA quite as well. And so there's reason to believe that is part of the issue with CVID and low IgA, you're not able to sort of defend the mucosal surfaces as well.
Right, thank you. So here's another interesting one, but this one may or may not be related. An individual states that they seem to have chronic sores in their nose, within the nose itself, and they don't seem to heal. Can you comment on if you've seen that before and how we might answer this question?
Yeah, I have seen that before, and it can be challenging. I guess I should say first, most people that have chronic sinus problems do not get sort of visible sores in the front of their nose, which is, I think, what this question is referring to. But it does happen, and to the point where some people will get ulcers that remain persistent. This can be challenging, and we often will try topical antibiotics. There are antibiotic ointments that can be put there to try to protect the area and allow it to heal up. But when there are sores like that, we also like to get the ENT doctors involved to have a look and make sure that there's not an infection that can be cultured, to make sure there's not some other type of inflammation that's causing a chronic ulcer that won't heal. So sometimes people even need to have biopsies of the area to kind of look at the tissues and see that there's not some other abnormality. But most of this is focused on topical antibiotics, topical protection of the area with things like petroleum jelly or other protective measures that you can apply. And sometimes it just takes a very long time for that to heal up. I guess the last thing I would say is it's important to if you have those sorts of sores or ulcers, to make sure that a nasal spray isn't contributing. And I know I talked about the nasal sprays in the presentation. Those can be really helpful, of course, for chronic sinus issues, but if they're not injected with proper technique, sometimes that can increase the risk of having a sore or an ulcer where you're spraying. And so that's another thing to have a look at and talk with your doctor about. Make sure there's no medicine you're on that might be contributing to the problem.
Excellent point. So here's a question. I use Dupixent for asthma, which is helpful. Would that perhaps help with polyps and sinus issues as well?
It certainly may. Dupilumab is a medicine that's been shown effective for asthma, but as I mentioned, has also been shown effective for nasal polyps. And so it's certainly not unusual that we see if someone's using that medicine, it will actually help both. It'll help the asthma, it'll help the sinuses. So while it's not great to have both of those things, you sort of can sometimes get a 2-for-1 with the Dupilumab treatment, meaning that therapy will help both of the conditions and is a very beneficial medicine in that situation for a lot of people.
Thank you. All right. Okay. Wow. Simple question, maybe complicated answer. How many sinus surgeries are too many? My son has had 13.
Oh my. Well, 13 is, I would say, is too many. I'm not sure there's a right answer to this, but I think, anybody that's had more than one or two sinus surgeries, it's time to look at why that might be. Some of it depends also on, over what period of time that's happened. If you have a sinus surgery and then you have another one 20 or 30 years later, maybe that's not such a concern. But people that have had one sinus surgery after another over, a few years or close together, that's usually a sign that we need to take a closer look at the medical management, meaning what's being done in between those surgeries that might prevent the need for future surgery down the road. And while it's not always the cause, nasal polyps are often a factor when we hear about many surgeries over and over, because those nasal polyps can recur. You can cut them out, but they will grow back. And we see many patients that have had, one surgery after the other to remove or address nasal polyps. So that's certainly a question when we hear of many sinus surgeries. And as we've talked about, there are newer treatments for nasal polyps that can really be helpful to prevent the need for recurrent surgery. But I guess, like I said, if people have had more than a couple of sinus surgeries, it's important to have somebody look at the medical management of the sinus issues and see whether that can be optimized to try to prevent more surgery in the future.
Great. So here's a question. If I have a lot of nasal congestion, mostly triggered after mine infection or stress, instead of pollen, should I still have allergy testing?
I think that allergy testing is probably worth doing for most people that have bothersome and recurrent or chronic nasal symptoms. Again, it is the most common factor that leads to chronic sinusitis problems. It doesn't mean that you're going to have allergies, but I think it's something that's probably worth looking into if the sinus issues are bothersome. We know that 30-35% of the population has allergies, and so just based on the odds, there's a 1 in 3 chance that that will show something that will lead to identifying a factor, and then the whole point of doing that is to have a plan that will reduce or help with that issue. So it's hard to say for any given person, but I think allergy investigation is something we think of right at the top of the list when we're trying to figure out why people have chronic sinus issues.
Great. So we have a few questions here about if there are any considerations or potential long-term problems taking over-the-counter decongestants on an ongoing and continuing basis.
Yeah, so this usually refers to things like pseudoephedrine, or Sudafed, people usually call it. That's the most common decongestant. There's another one called phenylephrine, but these are oral medicines that are designed to shrink the mucous membranes, and they do that by constricting the blood vessels that are in the tissues of the sinuses. My own view is that those are helpful, certainly for symptoms. They don't really address the root of the problem, any sort of inflammation that might be causing the swelling and congestion. So we do use those. I prefer to personally have people use those on a short-term basis or kind of as needed once in a while. The concern with the nasal decongestants is because they do have some mild vasoconstrictive effects, meaning they constrict your blood vessels. They can sometimes cause a mild increase in blood pressure in some people, and for people that have heart issues like abnormal heart rhythms, they can actually speed up the heart a little bit and have some mild stimulant effects. So most of the concern has related to cardiovascular issues, blood pressure, heart issues. In reality, we don't run into those very often. So I can't tell you that, it's dangerous to take them every day, but I do try to keep people from having used those every day with some of the other medicines that we think might not have those effects on the blood vessels.
Thank you. So another one here for you. Should patients contact their immunologist to be evaluated if they have sinusitis or possible infections, or should they just get a referral to see an ENT?
I would say, that it totally depends on kind of how your team and what your personal immunologist prefers. I think many of us would like to know that and would like to be involved in that, because there are some nuances with immunodeficiency. Like I mentioned, sometimes there's certain antibiotics we would prefer to use, or sometimes a longer course of antibiotics, and we certainly want to monitor for any rare complications of sinus infections. So I can't speak for each person or each doctor, but usually your immunologist would want to know about that. But a lot of patients will they'll have their primary care doctor, who is also, very available and helpful in that setting. And the ENT doctors can certainly be important if this is a chronic recurring issue, and particularly related to some of the anatomical concerns that can complicate recurrent sinus infections. So I would say, I guess in the big picture, it's kind of a team approach, and you have to sort of figure out what works best for you with your immunologist involved, and often we have to get different perspectives to sort of set up the best treatment plan.
Great. All right. So although we're running short officially on time, I'm going to make an executive decision, if you have the time, Dr. Riedl, just to try and bang out the rest of these questions. Hopefully, we still have the room and the platform won't shut us out. So we're going to try and keep going here. Is that okay, Dr. Riedl?
Yeah, let's go for it.
All right, let's keep going. Should you avoid swimming / putting your head underwater? It seems like sinusitis flares up with swimming.
Yeah, this is really related to kind of the drainage of the sinuses, right? So if you have issues, if people have issues with getting water in their sinuses and it doesn't drain out, there are people that, swimming and dunking their head under the water will leave some residual liquid in there, or fluid, and that can then, predispose to infection and other problems. So, ideally with if we can control the sinus congestion and the anatomical issues, we want people to be able to do these things like swimming, but it can sometimes be a trouble spot. And so you have to watch out for that. And it could be a limitation for some people that's a trigger.
Gotcha. All right. So again, we have a decent amount of kind of nasal irrigation questions. So this is kind of a two-parter. So is there a possibility, well, three-parter actually. Is there a possibility that an individual could wash some germs up deeper into their nasal passage if they're doing that? The second part is, what is your perception on some of the powered machines that may be used for nasal irrigation opposed to a neti pot or the bulbs? And then, so let's just go with those two.
Okay, yes. So there are many different ways to irrigate the sinuses, as people have mentioned already. My personal view is that the neti pot, sort of, gently rinsing the sinuses, really letting gravity do the work by, going in one side and letting it flow through the sinuses and out the other. That's sort of my preferred route for a couple of reasons. One is it's gentler. It's, listen, it's not comfortable to rinse your sinuses, but that's sort of the most comfortable way to do it for a lot of people, because it's not pressurized, right? You're not forcing fluid up into the sinuses, either with the bottle where you compress it or with some of these fancy machines. I don't think there's anything wrong with those machines if you tolerate it okay. Some people prefer it, but I just think that the tolerance is a little less with some of the more forceful irrigation measures. And that kind of speaks to the other question, I think, was, people are concerned about forcing bacteria up further into the sinuses. That's really not been much of an issue because, again, typically things will flow back out and it carries out. Anything that's pushed up flows back out. But that's part of the reason I prefer kind of letting gravity do its thing, because if there is any structural abnormalities, or if you have pockets where things fluid may get stuck, the pressurized methods might, in theory, push things into spaces and then it has trouble draining. So, again, I think it's preference. You kind of have to figure out what works best for you. But in my experience, for most of my patients, just the neti pot, gently irrigating has been very effective, and will work for what we want it to do, which is rinse out the mucus, the bacteria, the viruses, the pollutants, the allergens, and all the stuff that we don't want in there.
So to segue in that, speaking of allergens, do you recommend desensitization therapy in PID patients to reduce the impact of inhaled allergens, or is that not effective due to primary immune deficiency?
That's a great question that I don't have a great answer to. It's not been carefully studied, meaning that we know allergy shots, allergen immunotherapy, are very effective for most people being those with normal immune responses. And so it is something that we often recommend treating allergy patients. If, avoidance, you can't avoid the allergens and the medicines aren't working well enough or you're having side effects from them, then the shots are very, very effective and people will opt for that. What we don't know is if they work as well in immunodeficiency. And some of the way that we think allergy shots work do have to do with antibody responses, meaning that you make certain antibodies that block the allergic response over time. So it's a very good question that I don't have a very good answer to. I think for anyone with allergy shots, we usually recommend if they start it that we give it a good solid year to 18 months, and we expect to see some improvements in that first 12 to 18 months. So it's something that could be tried, but I think we have to keep an eye on whether it's helping or not, because there is a chance it will not be as effective in the setting of antibody deficiency conditions.
Great. Could tonsillectomy contribute to immune deficiency and chronic sinusitis?
Probably not, meaning that if you have your tonsils out, it may, the reason to do that really is the tonsils keep getting infected over and over again. And so that can solve that problem in terms of reducing throat or pharyngeal infections. I don't know that it has any clear impact on the sinuses, particularly in adults. I think those two are kind of separate issues. So I don't think a tonsillectomy is going to help sinusitis. On the flip side, I don't think it's going to, put you at greater risk for sinus problems either.
Speaking of greater risk, does having a specific antibody deficiency increase the likelihood or incidence of sinus infections?
Probably. As people likely know, specific antibody deficiency has not been studied as closely or as carefully as things like CVID or X-linked agammaglobulinemia. But again, there certainly are people with specific antibody deficiency that have frequent sinus and pulmonary infections, which is why they come to attention and come to the doctor, because they're getting sick often. So it stands to reason that in people who have that experience, the specific antibody deficiency is probably playing a significant role in those sinus problems, and that's why we would consider treating that specific antibody deficiency in that situation. Sure.
For those who have chronic sinusitis, would you recommend use of a humidifier?
Another complicated answer. So there can be some benefits to humidified air, particularly if you live in a very dry climate, or if your indoor air is very dry. Dry air can sometimes be very irritating to the sinuses, particularly if there's already inflammation. So there may be some benefits to a humidifier. The flip side to that is that humidity also increases dust mite populations and potentially mold growth. And so this is where it's important to know, are you allergic to things or not? Because if you're an allergic person, particularly with dust mite or mold allergy, that humidity could actually backfire and cause more allergic inflammation. So it depends, as with most of my answers, depends on your specific situation. Just be careful about the allergy issues if you plan to try a humidifier.
Very good point. Another question. So an ENT put one individual on compounded Bactroben nasal spray. Is this good for chronic sinus conditions?
Right. So the compounded antibiotics for the sinuses, whether those are sprays or some docs even put them in rinses. This is something also that hasn't been studied particularly rigorously. And so it's not something that I can sort of say, we recommend it to everybody because it might be helpful. The ENT specialists in particular tend to gravitate towards this, and there may be some allergy immunology docs also. I don't use them a lot in my practice because I just don't feel like the data is full enough to sort of know what the risks and the benefits of using topical antibiotics in the sinuses are. But certainly I have had patients come and tell me that, my ENT doc had me do this and it seems to help. So I think that's another gray area where we don't really know how helpful it is across the board for people, but it's something that could be carefully tried under the guidance and monitoring of your specialist if they think that may be helpful.
All right. Let's see a few more here. I don't think we're going to get to all the questions. I do want to be mindful of the total time and other things we have going on. So this kind of ties into perhaps the last question. It's one of the latest questions, though. Do you see a higher incidence of sinus issues in, this specifically CVID patients who use CPAP, especially with a heated humidifier? I think that gets to one of your prior answers just a moment ago.
Right. So certainly, as people know, we see lots of sinus problems in CVID, and the use of CPAP machines, which is very important for obstructive sleep apnea, of course, can sometimes complicate, sinus issues. My experience has been that the use of the warmers and the humidifiers, so that the air going into the airway is both warmed and humidified, that's actually helpful. Where we run into more problems is when it's dry or colder air, that really can irritate and flare up the sinuses. So it doesn't mean that everything will feel great and go smoothly, but using the warmer and the humidifier are usually a good thing. If that's not helping and you're still having sinus problems, then of course we have to look at all the other issues, allergy, and make sure you're on medicines that should help with that and so forth. But yeah, using CPAP machines can definitely make things a little bit more complicated for sinus problems.
All right. Well, actually, I think we're just about at the end of our time that we can have for this session. So I apologize for the few questions we couldn't get to, folks. But thank you so very much, Dr. Riedl. It's been an absolute honor to have you join us today. To everyone else, please enjoy the rest of the conference, everyone. We'll hope to see you in other sessions. And don't forget, we've got our 7 o'clock entertainment tonight, the Mind Reader. I'm really looking forward to that as well. So thank you very much, Dr. Riedl.
Thanks, everybody. Enjoy the conference.
Bye.